12 days ago, the Center for Disease Control reported that our nation reached another sad milestone in the AIDS epidemic. 500,000 Americans have now been diagnosed with AIDS, and more than 300,000 have died. On this very day and on every day from this day forward until we do something to change it, 120 more Americans will lose their lives. Another 160 people will be diagnosed with the disease. Nearly 140 will become infected with HIV. That's why this meeting is important. It gives us an opportunity to say to America what the facts are, to rally our troops, to search our minds and hearts, to leave here with more weapons than we came, to make progress in this battle. Our common goal must ultimately be a cure for all those who are living with HIV, and a vaccine to protect all the rest of us from the virus. A cure and a vaccine. That must be our first and top priority.
Michael, thank you very much for your introduction. Thanks for the warm reception here at the National Institute of Health. It's good to be back here again. For more than a century, the NIH has been at the forefront of this country's efforts to prevent, detect, and treat disease. And I appreciate the good work you're doing here. This is an important facility. It's an important complex, and the people who work here are really important to the security of this nation. Scientists who have been supported by the folks who work here have developed and improved vaccines for meningitis and whooping cough and measles and mumps and rubella and chicken pox and other infectious diseases. Because of the revolutionary advances in medicine pioneered with the help of the NIH, Americans no longer fear these dreaded diseases. Many lives have been saved. At this moment, the men and women of NIH are working to protect the American people from another danger, the risk of avian and pandemic influenza. Today, I've come to talk about our nation's efforts to address this vital issue to the health and the safety of all Americans. I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak.
Over the last week, my administration has taken several precautions to address the challenge posed by the 2009 H1N1 flu virus. Today, I'd like to take a few minutes to explain why. This is a new strain of the flu virus, and because we haven't developed an immunity to it, it has more potential to cause us harm. Unlike the various strains of animal flu that have emerged in the past, it's a flu that's spreading from human to human. This creates the potential for a pandemic, which is why we are acting quickly and aggressively. This H1N1 flu has had its biggest impact in Mexico, where it's claimed a number of lives and infected hundreds more. Thus far, the strain in this country that has infected people in at least 19 states has not been as potent or as deadly. We can't know for certain why that is, which is why we are taking all necessary precautions in the event that the virus does turn into something worse. This is also why the Centers for Disease Control has recommended that schools and child care facilities with confirmed cases of the virus close for up to 14 days. This is why we urge employers to allow infected employees to take as many sick days as necessary. If more schools are forced to close, we've also recommended that both parents and businesses think about contingency plans if children do have to stay home. We've asked every American to take the same steps you would take to prevent any other flu. Keep your hands washed, cover your mouth when you cough, stay home from work if you're sick, and keep your children home from school if they're sick. I said that fighting this disease had to be more than a national security priority, but an example of American leadership. After all, whenever and wherever a disaster or a disease strikes, the world looks to us to lead. And because of extraordinary people like the ones standing behind me and many who are in the audience, we have risen to the challenge. Now remember, there was no small amount of skepticism about our chances. People were understandably afraid. And if we're honest, some stoked those fears. But we believed that if we made policy based not on fear, but on sound science and good judgment, America could lead an effective global response while keeping the American people safe. And we could turn the tide of the epidemic. Earlier this year, I got a letter from a South Carolina woman named Ashley, who was expecting her third child. She was, in her words, extremely concerned about the Zika virus and what it might mean for other pregnant women like her. I understand that concern. As a father, Ashley's letter has stuck with me, and it's why we've been so focused on the threat of the Zika virus. So today I just want to take a few minutes to let you know what we've been doing in response and to talk about what more we can all do. Since late last year, when the most recent outbreak of Zika started popping up in other countries, federal agencies like the Center for Disease Control and Prevention have been preparing for it to arrive in the U.S. In February, more than 6 months ago, I asked Congress for the emergency resources that public health experts say we need to combat Zika. That includes things like mosquito control, tracking the spread of the virus, accelerating new diagnostic tests and vaccines, and monitoring women and babies with the virus. Republicans in Congress did not share Ashley's extreme concern, nor that of other Americans expecting children. They said no. Instead, we were forced to use resources we need to keep fighting Ebola, cancer, and other diseases. We took that step because we have a responsibility to protect the American people, but that's not a sustainable solution. And Congress has been on a 7-week recess without doing anything to protect Americans from the Zika virus. So my administration's done what we can on our own. Our primary focus has been protecting pregnant women and families planning to have children. For months now, the CDC has been working closely with officials in Florida and other states. NIH and other agencies have moved aggressively to develop a vaccine. And we're working with the private sector to develop more options to test for and prevent infection.
Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. They're politicizing it. We did one of the great jobs. You say, how's President Trump doing? They go, oh, not good, not good. They have no clue. They don't have any clue. They can't even count their votes in Iowa. They can't even count. No, they can't. And this is their new hoax. But, you know, we did something that's been pretty amazing. We're 15 people in this massive country. And because of the fact that we went early, we could have had a lot more than that. We will do everything in our power to keep the infection and those carrying the infection from entering our country. We have no choice. Whether it's the virus that we're talking about or many other public health threats, the Democrat policy of open borders is a direct threat to the health and well-being of all Americans. Now, you see it with the coronavirus. You see it. I also created a White House virus task force. It's a big thing, a virus task force. I requested $2.5 billion to ensure we have the resources we need. And so far, we have lost nobody to coronavirus in the United States. Nobody.